All right, you want me to push you higher?
Christy Howard has 2 kids and a lot of patience.
And woo!
In late 2017, Christy noticed something she couldn't ignore.
I had felt a lump, and I just made me kind of anxious.
Christy's doctor recommended a mammogram, and that led her to Watson Imaging in South City. Christy says they did the scan, and doctors at Watson Imaging told her everything was fine.
I was very relieved. I was like, okay, nothing.
9 months later,
It was in several lymph nodes.
Christy was told she had stage 3 breast cancer, something she believes her mammogram should have caught.
After I was diagnosed, I was then told by my doctor that he saw my initial mammogram, and yeah, it would have merited further investigation at that time.
So if that mammogram had been read correctly, your cancer diagnosis could have been caught a lot sooner.
Oh, 9 months sooner. It might have been a difference of stage 0 versus stage 3.
This summer, Watson Imaging sent letters to thousands of patients stating the Food and Drug Administration found image quality issues with over 2 years' worth of its mammograms. The FDA ordered Watson Imaging to stop performing mammograms immediately. Christy's mammogram was done just before that window.
I'm not surprised.
If the mammogram isn't read correctly, you can miss cancers for sure.
St. Mary's breast radiologist Dr. Cheryl Herman has been reading mammograms for more than 20 years. She says it's extremely rare for the FDA to take this kind of action. She explains why the images may not have met FDA standards.
It's just picture taking, really. So it's times when the picture is taken too dark or too light, there's not enough contrast, and most of the time when there is a problem, it is with positioning the breast. And then poor technique.
In a phone call, Watson Imaging's practice manager told the I-Team while she couldn't talk about any specific case, it was not an equipment issue and no one was fired. She called it a communication issue between the doctor and technologist.
If you're not talking to your technologist, then they can be running images through thinking that they're doing a great job.
After radiation, chemotherapy, and a double mastectomy, Christy is now cancer-free. She offers this advice.
I advocate to anyone who has any concerns to go to a breast center. They're more equipped. They're more capable. You know, I wanted to make sure that no one else has to go through what I went through.
Watson Imaging advises patients to have their mammograms reviewed or redone somewhere else. They tell us they haven't heard from anyone who claims their mammogram missed breast cancer. Now, yearly mammograms are recommended for women over 40. For the I-Team, PJ Randhawa, 5 on your side. The cold and the colors of fall remind Sharon Munden of the bare branches of her own family tree.
I have a maternal aunt who has had multiple recurrences of breast cancer. My mom actually was diagnosed.
So when Sharon found a lump and noticed inflammation on her breast, her doctor advised her to get a mammogram, and soon.
The night that I felt the lump on my breast, it was a Friday night, and I started calling right away.
It's a similar story for 76-year-old Jane Thompson. In 2011, she found a large lump and saw redness on her breast. Both women ended up at Watson Imaging, a mistake, they say, that could have cost them their lives.
Something was wrong. And I told them where the lump was, and the girl felt it.
I mentioned my symptoms to her, and she made a note of it. So I was feeling pretty confident that they were going to take my experience seriously.
After their exams, Watson gave both women letters stating their mammograms showed, quote, no evidence of cancer.
So it is a sense of relief, and it's like, the worst that could possibly happen isn't happening.
Both women decided to get second opinions. For Jane, the bad news came just 8 days after her screening at Watson Imaging.
She called me on March 16th, 2011, said I had breast cancer.
For Sharon,
within, a week and a half of the scan itself, I got my cancer diagnosis.
Did you wonder at that point, how come they didn't catch this when I was there last week?
Yeah, of course I did. So I called, I don't know what doctor I talked to. He said they should have done a biopsy that day.
Dr. Greg Cizik, who signed off on Jane's scan, told us it had been 10 years since he worked at Watson. While he didn't recall Jane's case, he said nearly 20% of all cancers are not seen on a mammogram. So the I-Team compared reports from Watson Imaging to reports from those second opinions. While Watson's radiology report showed no dominant or malignant mass, days later, Jane's doctor noted a mass in her left breast, expressing concern that it wasn't caught and that it was quite prominent. Those second opinions suggested immediate action. What do you feel like Watson could have done that they didn't do?
I wish that my results would have been not negative, but inconclusive. And I asked them to review other patient files.
That review didn't happen until the American College of Radiology, which accredits imaging clinics, conducted an audit at Watson Imaging in 2018. Finally, this past summer, the FDA forced it to stop performing mammograms immediately due to image quality issues. The FDA only sent letters to people for the last 2 years who had their mammograms done.
Correct, yeah.
Do you think it's worth alerting people beyond that 2-year period? Because your case was in 2011.
I just don't wish that on anybody else if it could be caught quicker.
Both women are now cancer-free. They urge other women to get their yearly mammograms at a breast health center.
My cancer was missed, and it just felt awful for women who may be in similar situations and didn't have the outcome that I did.
For the I-Team, PJ Randhawa, 5 on your side.
Mammograms done correctly can be 80% effective in detecting breast cancer. Last month, the I-Team talked to 3 women who say a local imaging center missed their cancer.
That clinic is now ordered by the FDA to stop mammograms altogether. Investigative reporter PJ Randhawa explains what women need to know before being screened for breast cancer.
Watson Imaging told all 3 of these women their mammograms were cancer-free, but that wasn't the case.
I was in disbelief.
Now I wish I would have done more.
My cancer was missed.
Soon after those mammograms, Jane, Sharon, and Christy were all diagnosed with advanced breast cancer. Dr. Debbie Bennett has been a breast radiologist for nearly 10 years.
There are, unfortunately, scenarios where it's not just that a cancer is missed, but that it can't be seen on the mammograms. One of the most common scenarios is in women that have very dense breast tissue.
She explains not all mammogram technology is created equal.
We always advise patients that they should have a 3D mammogram. It essentially gives you a look through each individual layer of the breast tissue. And most of the data show that you can find more cancers with the 3D mammogram, but also that there are fewer false positives.
This summer, the Food and Drug Administration forced Watson Imaging to stop performing mammograms.
It's pretty rare.
An audit by the American College of Radiology, or ACR, uncovered image quality issues.
What they'll do is ask for a random sample of patient mammograms on a specific day, and then an expert at the ACR looks at them and decides whether they do in fact meet standards.
Watson Imaging did not suggest additional testing for any of the 3 women. Dr. Bennett advises women to go to a specialized breast center for their mammograms.
Generally, if somebody comes in with a specific breast complaint, they say they're feeling a lump, nipple discharge, something like that, we use mammogram and breast ultrasound in order to evaluate that specific complaint. So breast ultrasound is an entirely different test from a mammogram that doesn't have the same issues with breast density that a mammogram might. I would go to a place that offers essentially full-service comprehensive breast imaging.
These cancer survivors couldn't agree more.
A place that's an actual breast center is going to have more up-to-date equipment, and it's going to have people who are reading it and they know what they're looking for.
For the I-Team, PJ Randhawa, 5 on your side.
All imaging clinics are inspected by the state of Missouri at least once a year. If you have had an issue with a mammogram at Watson Image, reach out to our I-Team.